Hi, I'm Dr. Eddie Finn. I'm a child psychiatrist and I work at Bay Point Children's Hospital. I am an inpatient psychiatrist here in this hospital, which is a teaching hospital for a medical school locally. A typical day here begins with our treatment team meeting, where I meet with the staff here on the inpatient unit, and we discuss all of the patients that are admitted to our inpatient unit here in terms of how their behavior has been overnight and what kinds of issues we're targeting, what kinds of things we're treating, what kinds of questions remain about diagnosis and so forth. As a child psychiatrist, I am involved in the diagnosis and the treatment of children and adolescents with all kinds of mental illness. And because it's a teaching hospital, one of the things that I do is I get to teach medical students and physician's assistant students and residents in psychiatry about child and adolescent psychiatry, about the practice of child and adolescent psychiatry, about some of the various things that make it the best form of medicine to go into, in my opinion. I find that after the treatment team meeting, it's nice to go and see the patients on the unit and to discuss how things are going in their life that day, to focus on what their particular treatment focus is, what they're working on, what they're trying to do in order to get better, how they're responding to the various treatments, including the medications that we have in place and the various group therapies and individual therapies that are in place as well. I like to discuss with them our plans for that day and for the next few days. We're always thinking about discharge, and so we talk about how long it might be that they're here on the inpatient unit and what's going to happen at discharge. Sometimes we even talk about how they're going to go to their aftercare appointments and what's going to happen during their outpatient appointments after they're discharged, hopefully to keep them out of the hospital. Generally, I have about anywhere from 8 to 15 children and adolescents on my service here in the hospital on a given day. They range in age from anywhere from 3 or 4 years of age on up to 18 or 19. I see each one of them on a daily basis, and I spend time with them individually, and then am involved every day with fairly extensive treatment team meetings, which are multidisciplinary, meaning that it's me as a psychiatrist, a therapist, social workers, the behavioral staff, and sometimes psychologists and occupational therapists and speech and language therapists might be involved in special cases as well. And again, because it's a teaching hospital, there's always at least one resident on the unit at any one time, and I spend a good bit of time with the residents teaching them child and adolescent psychiatry. There are anywhere from 1 to 3 physician's assistant students that are here on a monthly basis, learning how they might be of assistance on a psychiatric unit. And we have the occasional medical student here in this unit. Medical students in general focus on adult psychiatry, and this is a child psychiatry unit. But every now and then we'll have an interested medical student on an elective here. Well, there are some pretty extensive training requirements involved in becoming a child and adolescent psychiatrist. First, I think obviously you have to go to college, and you don't necessarily have to major in anything in particular, like chemistry or math or biology or psychology or anything like that, in order to get into medical school. But it is important to do well in school, and especially to focus on the pre-med requirements, which tend to be chemistry, biology, and physics, and calculus, and those sort of things. So once you are accepted into medical school is a 4-year educational curriculum. The first 2 years generally are more basic science curriculum, and the last 2 years are more clinical. Following the 4 years of medical school, you apply for the residency training, postgraduate training. Child psychiatry requires that you have 1 year of internship, which is a kind of a general year of working in various medical fields, whether it be internal medicine or family practice or pediatrics or other things, over the course of a 12-month period. And that's the internship year, or the PGY 1 year. PGY 2 and 3 are typically devoted to adult psychiatry, and PGY 4 and 5 are devoted to child and adolescent psychiatry. Once you finish with the residency program, both in adult and child psychiatry, then you are eligible to take the board examination for adult psychiatry first, and then the board examination for child psychiatry next. So most child and adolescent psychiatrists are board certified in both adult psychiatry and in child and adolescent psychiatry. I think it's important, I think, in our field to be fascinated by the growth and development of human beings. I think we have to be willing to see things from different perspectives, and I think it really helps if one can be very patient. I think if one goes into the field with a lot of patience, that's definitely a plus. But I assure you that if you go into child and adolescent psychiatry, you'll learn to be patient, because children who have mental illnesses and who are displaying various kinds of behavioral disturbances, they don't necessarily get well overnight, like children with, say, sore throats or runny noses. And frequently it's not just the child that needs help. Frequently it's the family that also needs some help. And sometimes it's the school that needs some help as well. So it's a little more complicated than some areas of medicine in that regard. I think far and away the best thing about being a child and adolescent psychiatrist is that you really feel like you're having a significant impact in a child's life or in an adolescent's life, or an impact in a family system that can be so important in the child's growth and development. Sometimes it can be life-saving even. On the other hand, there are some things that are very challenging about being a child and adolescent psychiatrist, and perhaps the most difficult thing about this work is that we hear a lot of sad stories. We see a lot of children who have been traumatized either by some perpetrator or by some circumstance. We see a lot of children that are victims of abuse and neglect. We see a lot of children that are very seriously ill, and frequently mental illness is not something that just goes away. Mental illness is chronic, and oftentimes when we see a child who's very significantly affected by a substantial mental illness, like say autism, that's a lifelong diagnosis. And while we can manage some of the symptoms and signs that the children may manifest, we don't have cures for a lot of the things that we treat. That's difficult sometimes, to think that even though we do our best work, we don't have cures for a lot of the things that we work with. There are a couple of things that I think one needs to remember when thinking about a career in child and adolescent psychiatry. And one is that this is not child psychology, which is a completely different field. Well, not completely different, it's related. But a child and adolescent psychiatrist is a medical doctor, and we frequently are called upon to assess children for diagnosis and treatment, and then we actually treat children with medications, and we prescribe treatments that are not always medication based, but we're the ones who write prescriptions for children who have all manner of severe mental illnesses. A child psychologist, on the other hand, typically evaluates and diagnoses and maybe treats children through therapeutic techniques, but not with medication. So there's a significant difference in the two. One thing to remember about being a child and adolescent psychiatrist is that in the United States, there's a substantial shortage of individuals who are trained and who work in this field. Because of that, anywhere that I'd like to work in the United States, I could probably find a very good, rewarding job doing what I do now, which is a very comforting fact, especially in these times with the economy being the way that it is. As a child and adolescent psychiatrist, I have a very marketable skill.